Welcome, folks. We are just letting people in, and we will be starting in a minute. You might use the chat today and put your name and where you're from and your role there. We may have people from different countries, so add that as well. We're just so glad to welcome all of you for this informal discussion. Start today. This is going to be an informal conversation. And I want to say we value your time, and we hope that you have come today to share what you're doing about awards. And we have others who we've talked to over the last few weeks to talk about their awards. So I think we're all going to learn together today. So welcome to this PFCC.Connect informal conversation. The focus today is awards for excellence in PFCC leadership and practice. I'm Bev Johnson. I'm President and CEO of the Institute for Patient and Family-Centered Care. And joining me today are colleagues Deborah Dockin, who is IPFCC's coordinator for patient and family partnerships. She's a family leader herself. And Ushma Patel, who is director for special projects in our educational programs. And Ushma is providing technical support today to make sure that all things go smoothly. So thank you, Ushma. And I think both Ushma and Marie Abraham will be helping to monitor the chat. So please use that and share ideas, questions, and your best practices around awards. As always with these conversations, we want to learn from each other. So we all, hopefully you will share and we'll go away with some new ideas. We will be recording everything today. So if your colleagues want to hear what you've learned or you want to go back to it, it's all going to be in the PFCC.Connect conversation folder. And if you haven't joined PFCC.Connect, it's a great informal network of people from all over the world. So a reminder again to chat in your ideas and your exciting use of awards. And before we really get started, Ushma is going to conduct a poll just so we know who's in the room with us today. Can you all check and let us know who's here? Looks like it's happening. So it looks like we have a nice mix of people, with people who are coordinators of patient and family-centered initiatives, a number of patient and family advisors, leaders, people in patient experience, patient relations. We even have representation, which is wonderful, from diversity, equity, and inclusion, and some clinical and administrative leaders, and some more clinicians, and a community program. So just to set the stage for the conversation today on PFCC awards, what we've set it up to do is to really focus on awards that recognize excellence in patient and family-centered care and those related partnerships among patients, families, and healthcare professionals. And really, why is that important? Well, really helping to make PFCC tangible, visible, see what it really looks like. That is one of the key reasons for doing this. I think that we want to help people understand what it is and what these partnerships look like and feel like, and the benefit they bring to people, individuals and families and organizations. When you and many of them that we know about have been started by the PFAC and patient and family leaders. But I think they can reinforce the organization's strategic commitment to partnerships and to PFCC. It gives visibility at a very senior level. You can involve, certainly if you give an award to a leader, that recognizes leadership. But if you involve leaders in presenting the award, involve leaders in presenting the award at a senior hospital health system meeting, again, it helps reinforce at a very high level the organization's commitment, strategic commitment to this culture of patient and family-centered care. And it also helps to develop champions, PFCC champions, people who believe in it and who practice it. It can inspire others to want to become a PFCC champions, and it gives these champions a stage. And you want to foster transformational leaders in your organization that's really going to work with you to bring about change in organizational culture in profound ways. And so making a stage and calling it out and making it visible for people, that's really what awards can do. I think they also help us really highlight the value of excellence in collaboration. And we often talk about authentic collaboration and partnership. And I think that that's important to convey through your awards. And lastly, this is a really hard time in healthcare. I have such appreciation for those of you who are working directly in healthcare today and what you have gone through for the last 2.5 years with the pandemic. And to be able to express gratitude and appreciation, this will contribute to the well-being and the nurturing of staff and clinicians and leaders and even patients and families who are sharing their expertise with us as partners in collaborative endeavors. So I think there are many reasons that we want to have awards that recognize this kind of commitment. So I'm going to turn it over to Deborah to talk a little bit about why IPFCC has a partnership award.
Okay, thanks so much, Bev. We thought in beginning this conversation with you about awards that we wanted to talk about our own partnership award, which was initiated in 2017 and recognizes teams of healthcare professionals and patients and families who collaborate together, and through that collaboration change healthcare in positive ways. You see on this slide the first recipient of the award was Kamansky Children's Hospital in 2017 for their simulation discharge program for parents of technology supported children. And I know I saw on the participant list that Courtney Natraj, one of the people in the photo, is with us today. She is a longtime family leader at Kamansky, and we're so happy you're with us today. Next slide, please. We then went on in 2018. The award winner was a program at the University of Michigan, the Adolescent Health Initiative. And interestingly, and we'll talk more about these kinds of things later, It was a collaboration with their Teen Advisory Council. In 2020, the award winner was the University of Texas Health in San Antonio, and it was the beginning of awards recognizing some of the difficult and very relevant issues. So this was an award for a program that addressed food insecurity. That was
all these things that people are getting awards for, we do.
that was designed in collaboration with the PFAC. Just to end this discussion about our award, we urge you to nominate a team from your organization for the 2022 award. The deadline is in mid-August, so there's still time. So thinking of all those reasons for the award program that Bev talked about, please nominate a team and recognize their good work in your organization. So Bev, I'm going to turn it back to you.
Sure. So now we're going to talk a little bit about different awards that are from a variety of different organizations and how they celebrate excellence in PFC leadership and practice. And I hope you'll chat in thoughts that you have. And we'll first hear from Julie Moretz. And Julie, you want to introduce yourself and the current hats you wear and tell us a little bit about this special award.
Sure. Hi, everyone. I'm Julie Moretz in Augusta, Georgia, and I am the Associate Vice President for Patient and Family Centered Care here. But I got my start as a patient family leader, as a patient advisor many years ago. So I'm delighted to be in this role to bring patient and family centered care forward in a different perspective from my perspective as a patient and family leader. I'm so excited about this particular award. Many of you may have known about Pat Sadomka years ago. She certainly was a national leader, international leader, and helped us pioneer patient and family centered care here at AU Health. Back in the day, it was Medical College of Georgia and has since changed a few names, which you are already familiar with that. But for us, for this award, it really is so important that leaders are recognized and are visible in showcasing what patient and family centered care looks like on a day-to-day basis. And certainly Pat looked at this. Pat died in 2010, so this award was really established in her honor, just to remember her phenomenal leadership and her legacy through the years. This is a coveted award here at AU Health. We have very specific criteria. You can go to our website, but very specific criteria. We have patient advisors who also serve on the review team to review the nominations. Typically, we would present this award the night before our PFCC conference, our annual conference. Due to COVID, the last 2 years, we actually did it at our PFCC conference. And I will say, I can just see Pat smiling down now, though, because 2 years ago when we had to present it, COVID was just running rampant, everything was wild, and we decided to present this award posthumously to one of our nurses who certainly, would be following in Pat's footsteps with this award. So we think about that, and everybody was so proud. And I think that even elevated it even more, because they knew this particular person who received it, who had just died in our organization. We do have very specific criteria, as I mentioned, but we also have a rubric with the awards grading scale, and we follow this very specifically because we have so many great nominations. If anybody's interested in me sending this to you, I would be more than happy to do so. I'm trying to think, Bev, if there's anything else you would like for me to share. We do a number of other awards, but I think this one is so important just for the reasons that Bev was saying, the leadership visibility.
Thank you, Julie. And I have to share with you, I was doing a site visit for an American Hospital Association site visit a year ago. And one of the recipients of the Pat Sadamka Leadership Award was part of the team that I was interviewing. And she had it displayed in her office. She works in a different health system now, but that inspiration she has carried to a new organization. So
Great.
probably more than you all had thought, but that thank you so much for sharing. And the we have a really interesting award. Cheryl, I think I saw you earlier from Children's Mercy in Kansas City.
Right. Hi.
Hi, Cheryl. Would you introduce yourself and tell us a little bit about this innovative award?
Sure, I'd be happy to. So my name is Cheryl Chadwick, and I'm actually from Children's Mercy, Kansas City. However, the award I'm going to talk about is the Missouri Hospital Association PFAC Award. And the MHA started a PFAC 5 years ago. And this is our first award where we want to, and we actually calling it the Compass Award, and it's going to recognize a hospital for their outstanding effort with their PFAC. And so we, told them that through the public recognition, the honor is going to encourage and inspire hospitals to adopt and or improve their PFACs. And we named it the Compass Award because we wanted to talk about that it incorporates the idea that each direction that we find partners in care. So we explained that the North symbolize our patients as our true North focus for service. The South symbolizes our caregivers and families. The East symbolizes the healthcare providers, and the West symbolizes the hospital staff. So we set out an application. It was, only about 10 questions. We didn't want to make it too long. We also limited applications to PFACs that were less than 5 years old. And the reason that we did that, because 2 of the pediatric hospitals in the state of Missouri have representation on the PFAC. And our PFACs are so engaged and have done so much that we were like, hands down, the pediatric hospitals would have won. And what we wanted to do was recognize those that are just starting their PFACs and encourage other hospitals to actually engage in a PFAC if they haven't already done so. So we got in several nominations. They were sent to the PFAC members. They were blinded and sent to us to grade on a 5-point scale. I don't even know who the winner is yet because it's going to be announced at the MHA convention later this fall.
Cheryl, when you and DJ first told me about this award, I was so excited about it because just think if we could get awards like this at all the state hospital associations and in Canada and the provincial organizations and even countrywide. So we have friends I've seen so far from Italy that this will inspire people to get started. And, I think there were so many parts of this that I think really could be replicated in other places.
Yeah, we're very excited about it. The winners will get some hardware, and then they'll also get a toolkit to put on their website. And then I like the fact that they're presenting it at the statewide convention, so it'll get a lot of visibility.
It just will highlight partnership and what it looks like again. So thank you all for doing that.
You bet.
And now we'll move to Florida. And Anne, would you introduce yourself and tell a little bit about the awards program at Moffitt?
Thank you, Bev. Yes, my name is Ann Feidelman, and I'm the manager of the Patient and Family Advisory Program at Moffitt Cancer Center in Tampa, Florida. And one of the favorite parts of my role is to be able to coordinate the delivery of these awards, PFAC Awards of Excellence, to departments, inpatient units, outpatient clinics, or individuals now. And this picture really tells 1,000 words. I find that I personally feel that recognizing excellence is one of the most effective things PFACs can do. we're always working on how to improve things and improve engagement, improve collaboration. But when you recognize excellence in patient family-centered care, it really can impact behaviors. And like Bev said earlier, we always have leaders and patient and family advisors there giving the awards. I kind of give a little bit of a brief introduction of how process goes for how a team or an individual is nominated and voted on to receive an award, and then hand it over to the patient and family advisors to kind of share their story of why this team was recognized. And it's so impactful to the team members. That's what I love witnessing. They're so moved, sometimes to tears. And then we always have COO or other VPs or CNO attending these. Everyone loves to attend them, so that's not hard to make happen. And we also always celebrate with the same. Wright's Deli is a wonderful caterer in Tampa that makes wonderful cakes, and everyone at Moffitt loves their Wright's cakes. So we always celebrate with that, or individualized cupcakes through COVID. But this team is the transport team, and the reason they received the award was because, when they're transporting patients back and forth, we heard from many of our advisors that they're always engaged in conversation with them and making connections, and not, talking to somebody else or ignoring the patient. They're engaged. That's their role. And the gentleman in the front row that is holding a bag, you can kind of see, he also received an individual award from a patient advisor because he really made a connection with her and would make sure to, tell her a little bit about his life, and made her feel like she was really seen and being treated with dignity and respect through some difficult times, being moved around throughout Moffitt by wheelchair. So I just feel that these awards are so impactful, and it's an honor to give them out. We started recently, like a year or two ago, with I don't know if you can see it, but it's an individual pin, an individual award of excellence too, that we designed. Oh, there it is. And we also can nominate team members to receive those as well. And they wear them proudly on their badges. And, we make a big deal about that as well. And I just want to tell a really short, and I'll be really short story, but in my role, I once met a patient here at Moffitt, and he asked me what I did at Moffitt, and I told him about PFAC, and he said, well, I have to tell you something, because I used to be head of the radiation department. And many years ago, when we were under construction, we won the PFAC Award of Excellence. And he said, out of all the papers I've published and out of all the work I've done, it's the most important and most meaningful thing I've ever won. And I thought, well, that's the power of an award. I really didn't know it had that kind of significance. But I was really felt fortunate that I got to hear that story from him. So I think that's
wonderful. Thank you so much. I'm going to turn it over to Deborah in a second, but I didn't know whether anyone had questions or any awards that they'd like to share at this point. Deborah's going to be able to share some other awards, but I'm not able to see the chat right now. So if Deborah, you see that someone wants to share something, could you call on them, or Ushma, or Marie?
Yes, I'll do.
Anything there, or should
Nope.
Deborah take over now?
No, you can pass it on to Deborah.
Okay, thank you, Bev. We do have a few other examples to share with you, and thought that we would, with these, focus a little on what were the goals of the award program. I think we've heard a lot about that already. And what was the the process of developing it and who was involved in that development. Next slide, please, Bev. So Michigan Medicine has an award program through their Office of Patient Experience. It's actually more than one award program, the Hope and Joy Awards and the Celeste Lee Peer Mentor Award. The Hope and Joy Awards are targeted towards staff, whereas the Celeste Lee Award recognizes patient and family advisors. But in both cases, whether staff or patient and family advisors, it's people who have gone above and beyond in promoting and advancing patient and family-centered care. This program is now in its 12th year, so it's been around a while. And it started with a family memorial donation and is now managed in the Office of Patient Experience, but with input from patient and family advisors. So that's one example from Michigan Medicine. Bev, if you could switch to the next slide. And Darcel Jackson, our colleague from Children's National Hospital in the Washington, D.C. area, is here with us today and is going to talk about their award.
Thank you, Deborah. At Children's National, we, since 2010, have had our PFAC Excellence in Patient and Family Centered Care Award to recognize and honor not just individuals, but units or teams or projects that demonstrate the outstanding commitment to patient and family centered care. And this award is what I have been told feels like the Emmys of Children's National, partly because the nominees can be from other staff members, other teams, but also from our patients and families. And we have a really robust kind of scoring matrix that our PFAC parent advisors look through each and every nomination, and we score it based on whether it's meeting certain criteria of patient and family centered care: respect, information sharing, participation, collaboration. And collaboration, if it's a staff nominated award, collaboration, kind of what does that collaboration look like across teams, and can it be replicated? And then if it's a nomination from patients and families, did that nomination speak to really the attention and the devotion to patient family centered care principles, but also really partnering with the family and consulting and what that family is really saying was important to them in that care. And this award, we kind of surprise the nominees for two different reasons. So we kind of let them know that they're finalists, but then the winners, we surprise them with balloons and breakfast, depending on the departments. And if there's a multidisciplinary group, we reach out to the managers to kind of get them all together and surprise that. But the big award, where there is a plaque and really organizational recognition, happens at our annual board meeting. And so therefore they get to get dressed up and they get to stand in front of the board and all the recipients and really receive that award and get that big national recognition. I think there's another award that I also wanted to make sure that I was talking about that we do that's really to make sure that we are getting patient and family partners involved in work in the very beginning. And so with that, we've created a PFAC seal of approval so that any project work can get the seal of approval that basically establishes that PFAC was involved in the very beginning and through the process. And so we allow any of our teams and staff and individuals to apply for that award. And this is an ongoing award. So it is not like the Excellence in Patient Family Centered is kind of just once a year big award, but this is ongoing, where we can recognize these true partnerships that PFAC is not an afterthought, that we were part of in the beginning. And that's what criteria is. PFAC has to be at least 60% involved in the project to be able to get this award. And it has to incorporate not only patient and family centered care principles, but also our incorporating the core values of our institution of compassion, commitment, and connection, as well as also considering diversity, equity, inclusion. So all of those are criteria in getting this award. And then they get the actual seal that they can use, if it's the documents that they can use to publicize the patients and families, that other patients and families were involved in the making of this. But this will also encourage others throughout the organization who are doing this work, that if they want to get this award, they have to really be mindful and thoughtful of including patients and families in the very beginning. The other caveat I will say to this is, it is not always that they have to include any of the PFACs. We really want to, utilizing our PFACs we love and is great, but sometimes if we also want to encourage them to use families, members that they're interacting with on the ground. And so they just have to show that they're including patients and families and show how they've done that, whether it's through town halls and focus groups, et cetera. But we really wanted to not only embrace utilizing the existing PFACs, but just really patient and family centered care is really about involving patients and families.
Thank you, Darcel, for that really rich description of those programs at Children's. We can open it up to questions in a minute, but we're going to just share a couple of other examples. This one is St. Jude Children's Research Hospital and their awards program, which was started in 2013. So again, it's been in existence for a while. They have what's basically a two-tiered awards program to recognize staff who exemplify the values of patient and family-centered care. So at one level, they select patient and family-centered care champions, and in a given year, that can be several staff members who are selected. But then out of that group of champions, the next level of award is selecting one partner in excellence winner for a particular year. And these photographs are their partner in excellence winners for the last few years. I know the print is far too small for you to see them, but like Anne talking about the transport team at Moffitt, there is variety in the roles and the units that received these awards at St. Jude. Parent members on the PFAC at St. Jude both nominate and select these winners. So again, the PFAC has a significant role. Next slide, please, Beth. And last but not least, Suburban Hospital in Bethesda, Maryland, where they have a patient and family-centered care leadership award. So coming back to specifically highlighting leadership. So again, the winners are leaders who both demonstrate a commitment to patient and family-centered care, but also help bring on other people in a leadership way to more fully embrace patient and family-centered care. This is specifically a program of their PFAC. So the nominations come from PFAC members, and the selection is done by the PFAC. And this program was started in 2014. So again, it's been around for a while. We shared this photo of the 2020 recipients specifically to highlight again the variety of roles and departments within hospitals that are recognized. So the winner on the left, Margaret Fitzwilliam, is the Director of Capital Renovation Planning and Space Management at Suburban. And that very long title meant that when they recently constructed a new building, she was leading that effort. And so she got the award for her very active inclusion of the PFAC and patients and families in that whole process of designing and building the new hospital building. So Bev's gonna ask a couple more questions of you all, but just in some of the examples that we've shared, I think what stands out to me is the role and the impetus of PFACs and PFAs in these programs, being involved both in the design and the nomination process. But I think it's also very positive about the longevity of some of the programs. I mean, they've been around. And finally, I think we've seen some examples where these award programs and in their nomination process have really been able to pivot and look at their awards in the context of what's been happening in the last couple of years. Anyway, I'm going to turn it over to Bev now.
And again, I thank you, Deborah. That was terrific. I love hearing about these different awards. And are there others here that want to share something about their award? Have we covered different ways to talk about the eligibility? Some of them are targeted specifically for patient and family advisors and the work they do. Others, it's around staff and leadership. Is there something about the nominating process that we've heard from various people? And I can't see my chat today, so I feel like I have my hands tied behind my back a bit. Anybody want to offer anything in addition to what we've shared? We're going to share links with you for other, so you can follow up with each of the programs.
I have nothing specifically in the chat right now, but
okay. Well, that's all right then. Just keep me posted. And I think that as you go back and talk about having an award, you want to be clear about eligibility and then having a broad process for nominations. I've seen many of them on the website, but people are sending out e-blasts within the organization. You could use your hospital intranet to post that this award is happening. I just think today hospitals are looking for ways to create a sense of gratitude for staff. And so you could build on that kind of momentum. And then are there, for those of you, it's been great to see some old friends who come to this informal discussion today. Are there any challenges that you were worried about getting started, or have you had trouble during the pandemic in terms of making it difficult to award these? It sounds like you've made adaptations. Darcel, I see your hand.
Yeah, I'll just share a challenge that we had that may be helpful for others. Is I think as PFAC has had several awards, specifically our Excellence in Patient Family Centered Care Award, it did come a time where we really had to strategize with our PR and marketing team and other groups around the organization, because there's a lot of awards in healthcare sometimes. You know, there's the Daisy Award, which a lot of people know, but there's lots of other awards. And honestly, some of the awards come with different recognition, but we also had internal awards. We had our core value awards that our corporate leadership put on, but that had a monetary a monetary prize for it. And so we really had to be strategic and partner with our patients and our PR marketing team on the timing of the award. So was not in conflict. So people would also feel that there's room for all, but that they're not competing with having to do a whole bunch of nominations and applications at the same time, but also really specific on how we market our award and how it's different from these other awards. So I just want to put that out there for organizations that have many awards, is the timing and the communication and the marketing and what may be different about it, especially if there's no monetary prize, is really probably important in the conversation.
That's great to share. And the last informal conversation we had was about websites and how to make them really speak more directly to patients and families and to the practice of patient and family-centered care. So those relationships with PR and marketing are really important in so many ways. I see lots of your heads nodding, and so build on that relationship. And that's great to think about that in terms of how you position these awards. They can really help you a lot with that. Anybody else, either put your hand up electronically or wave at us that want to add something?
Bev, one thing that I heard in the conversation with people sharing examples was talking about having very clear, specific criteria for an award program. And I wondered whether any of the people who have those criteria wanted to share a little bit more about how you develop them, how you rank them. We too have criteria for the Partnership Award Program. And I mean, there's kind of a complicated grid that with a review committee that's external to the organization. So I wondered whether anyone else wanted to share about criteria.
Yeah, I can share about Children's Mercy. So we've got, every month we recognize our ambulatory providers who've received the top box scores. So that's a 9 or 10 for their provider rankings on their patient experience survey. So we call it the top box Rockstar Award, but it's kind of like the People's Choice. This is your patients and families saying that we're giving you a 9 or 10 when we actually rate that provider. So it's up to everyone that gets that 9 or 10, and they get like a thank you note from leadership, and then once a year we do the Hall of Fame, and it's the top 20% of the providers that get recognized by the patient experience surveys. And then we also do monthly a Shining Star Award, and that is for the highest ranked provider over the last 12 months. So it's blown up, all the leadership is there, balloons, plaques, all sorts of celebrations where we celebrate one provider every month that has the highest rankings, again, by our patient experience surveys. So that's kind of a cool thing. Then we also celebrate a patient and family engagement rising star. So that's for the division who's increased their rating the most for the completed fiscal year. So our fiscal year ends on June 30th. So we're actually celebrating all of those this week. And so we give 2 awards, one for a large division and one for a small division. So, you know, who's done the best as far as using those actual quantifiable numbers of who's increased their patient experience ratings. And then we also give an award for the team or division who accomplishes their metric, their target, what they were assigned at the beginning of the year. And we call that, they get a True North Star Award. And then we also have patient experience champions that we recognize once a year, and then honorary patient advocates awards. And those are actually by nomination. So those are qualitative awards that people nominate for those awards. So we've been doing lots of celebration this year. With the last 2 years of COVID, our leadership said, blow it up. You know, let's do lots of celebration and make it known throughout the organization. So we've all put on fun backgrounds, you know, like balloons and stuff, backgrounds. So those that we're doing virtually, they can identify who our, you know, the patient and family centered care team is by those, and then the leadership all join. And then we've been able to do a few in person as well. So it's been a really fun week celebrating everybody.
That's great. Thank you for sharing that. And that's coming out of the patient experience department, Cheryl. Not
yes,
so
but like so the Office of Patient Experience at Children's Mercy, it is the parents on staff, the patient and family engagement team, with all of our PFACs as well as our patient advocates make up our Office of Patient Experience.
That's great. That's great to hear for others. Others have ideas about how they've created these awards and any challenges that they've had? Anything in the chat? If not, I will move us forward, and just lots of good ideas. And we put together for many of the awards a link so that you can go and get further information. And I think everyone who joined in the conversation today willing to share more. So one of the awards that I was aware of when it was getting started was at Seattle Children's. And I thought it was really interesting who they put on the committee. They wanted to start the award. They were learning from others, just like this conversation today. And they said, okay, we'd like to have an award like that. And they thought, well, who would be on the selection committee? And it was the residents spoke up and said, we would like to be represented on the selection committee. And they asked me whether they should do that and whether they should allow that. And I said, what a great way for our future clinicians to learn about patient and family-centered practice, to be able to serve on a committee like this, to really celebrate the best of the best. So they have done that. I don't know whether the pandemic has slowed them down at all, but that's a program that we've been watching from afar for quite a while. And then we put a couple of, the Society of Critical Care Medicine has an award. So that's again at an association level. And you could tie that in or recognize someone who's received that award from your organization, or you could also nominate somebody from your critical care areas. So that's something that you might want to look at. But I hope those links will be useful to you as you move forward. And then always, we hope you will continue to be involved in the PFCC informal conversations and just use that online community to pitch questions and to respond to the discussions. We are finding we all learn a lot at IPFCC from those discussions. And these informal conversations are a part of the PFCC.Connect. And then I think a lot of you know that this is our 30th anniversary year. It's hard to believe, 3 decades. And it's just a very exciting time. And so we're really putting special emphasis on the partnership award this year. And we have extended the deadline till the middle of August. I know summertime, and particularly this year, is really hard for folks, but please, if your organization or share it with colleagues, you can find more details about the award on our website. And here's the link. And we will be having a special virtual celebration of the winners in the fall. So stay tuned for that information. And
Bev, I'm sorry. Just one thing I forgot to mention before about this year's partnership award in the nomination process, that we always emphasize innovation and of course collaboration and partnership. But this year, special attention will be given in the review process to innovative projects that really addressed what we refer to as timely and relevant issues like the pandemic, diversity, equity, and inclusion. So again, this is a great opportunity to recognize teams at your own organizations.
great. Thanks, Deborah. Anybody else have anything else they want to share before we close today? And we will be sending, Ushma will be sending out an evaluation. So please feel free to respond in that and let us know, what you'd like to have as the next informal conversation. We really want to build on your interests and needs and questions and excellence in the work that you do. So thank you all very much for joining today, and wishing you a safe, well time in the work that you do. Thank you so much.